I couldn't walk,
Yeah.
so in severe pain.
Which knee were we dealing with you?
Left.
So how long have you been dealing with that before we had seen you?
Probably a month.
Okay. What kind of stuff were you doing for the treatment on that?
Um, Nothing. I didn't really know what to do. Well, I'm sorry. I did go to a surgeon, and they said that I needed a knee replacement.
Yeah. So knee
And
replacement was an option.
And I said that's not an option for me personally, but it could be for other people. So that's when I seeked you out.
Awesome. So
Yep.
what are some of the things that you couldn't do before? Like you were having, because weren't you like moving batteries and stuff like that, or you doing
Yes.
a lot of mobility?
I own a battery business, and I'm a working owner, so I had to do a lot of that stuff, and so that was a hindrance. I actually couldn't do it.
Yeah. So now are we able to get more mobility and less pain now?
Yes.
Okay. How long ago did we start the treatment on you?
60 days
I think it was about
or 90 days.
within 2 or 3 months, right?
Correct.
And then our pain went from like you were closer to the 9/10s, and then where are you now?
A half to one, maybe.
It's awesome.
Maybe.
All right, now one of the reasons I wanted to do this little interview with you here is that one of the most profound ways to get these types of results is the diet. So how important would you say it has been losing? Like how much weight have you lost, and what has mostly worked for you?
I say the diet was, if you're asking how important it was, very important, because I've noticed not just in my knee, but inflammation in my whole body. Like my elbows used to hurt and all that. So that was key, along with your treatment. But and then what was the other part of the question?
What was some of the things that you had mostly changed in the diet to get that kind of result?
Well, I wasn't eating in the mornings because my metabolism was broke, so I thought fasting was the way to go. You corrected that. And then basically I just do a lean and green diet.
It's amazing, right?
Eat in the morning a little food, a little bit of food, and 5 hours later, and 5 hours later, and then don't eat 3 hours before dinner.
You nailed it. Okay,
Or
so what did we do
bedtime.
treatment-wise on you? We did what was all the treatment we did with the injection? With PRP, stem, did we do all that?
Yes.
So we
So we
started,
did PRP twice, and then the last one was the stem injection
okay, and then
with PRP.
and then we braced you also.
Pardon?
Then we braced the knee.
I had a brace that I wore.
I know you're not wearing now.
No. I can walk without it, and sometimes I get a little bit sore, but it's bearable. I mean, now you just think of it as, well, you're just getting a little older, and that's a part of it.
Yeah.
And versus it was crippling, and I couldn't walk.
A lot of people who are in the position you're in would have a lot of pain, and they're told that they need a knee replacement. What would you give them for advice as far as looking for some of these other regenerative medicine treatments?
Well, what happened with me was my mother has had knee replacement, and it didn't go well for her, and I know several other people, and I just thought to myself before I go down that road, because when you cut bones, there's no reset button, that I was just going to seek out other options, and I knew that I was overweight, so that could be one option, but and I found you on Facebook.
Awesome.
Facebook's good for something. Yeah, it was like I was laying in bed at night, and I'm just researching, I'm reading, and then a Facebook ad, and then I go, Dr. Balasar, I'm gonna. So the next morning I told my wife, I said, I think I'm gonna go see these people and just see what happens, and it worked out. So it was great.
I'm proud of you, man. So we lost 30 pounds. Our pain scales went down, and you kind of look like you're taking over a new aspect of life now.
Correct.
That's awesome, man. I'm proud of you. Thank you so much.
Thank you.